Imagine taking Wegovy without ever touching a needle. No pens, no injections, just a pill, once a day. That future is getting closer than most people realize. And if you are thinking about weight loss treatment, this upcoming version could completely change how you start, or stick with, semaglutide. Let us unpack what we know about oral Wegovy so far, what it means for you, and who it might actually be better for. Right now, Wegovy is only available as a once-weekly injection, but Novo Nordisk, the same company that makes Ozempic and Rybelsus, is working on a daily oral version of semaglutide specifically designed for obesity treatment. Technically, they already have a pill form, called Rybelsus, but it is approved for diabetes, not weight loss. And the doses are much lower. This new oral Wegovy, it is aiming to deliver higher strengths that match the weight loss effects seen with injections. So, what is the status? As of now, late-stage trials are wrapping up. The company has submitted new data to the FDA, and the review process is underway. That means approval could come in the next year if the safety and effectiveness check out. But how does it actually work? The pill version uses a special ingredient called SNAC, that is short for sodium N-8,2-hydroxybenzoyl aminocaprylate. It helps semaglutide survive the acid in your stomach and get absorbed into your bloodstream. But even with that technology, oral semaglutide is much less bioavailable than the injection. What does that mean for you? Basically, your body absorbs less of the drug from the pill, so you need a higher dose to get the same effect. And yes, that can mean more cost or different side effects. So let us talk about pros and cons. The biggest pro is obvious: no needles. For people who hate injections or just cannot stick with weekly shots, this could be a game changer. Also, a daily pill builds routine. Some people actually find it easier to remember something every morning rather than a once-a-week ritual. But here's the catch. Because of the lower absorption, the oral version may not work as powerfully, especially if you miss doses or take it the wrong way. It has to be taken on an empty stomach, first thing in the morning, with no food or drink for 30 minutes after. That is non-negotiable. Another downside, side effects like nausea might be more frequent during early use, just like with Rybelsus. And the cost? That part is still up in the air. It depends on insurance, FDA approval pathway, and how Novo Nordisk decides to price it. So, who is oral Wegovy actually for? It might be ideal for people who have injection anxiety, need a more discreet option, are looking for long-term maintenance, not just rapid weight loss, already tolerate Rybelsus well. But if you are someone who wants maximum weight loss effect and you tolerate the shot well, then the injection will probably remain the gold standard for now. Let me give you a real-world example. One patient I spoke to had been on Wegovy injections for 6 months, lost 28 pounds, but dreaded injection day every week, switched to a lower-dose pill for diabetes, and could not keep the weight off. Why? The dose was too low, and the pill routine was hard to stick to. That is exactly what the new oral Wegovy hopes to fix, but it is still not a perfect swap. Now, a quick heads up, even when it gets approved, supply could be limited early on, just like we saw with the injectable version, and not every pharmacy will carry it right away. If you want to stay ahead of the curve, talk to your provider now. Ask if they are planning to offer oral semaglutide when it becomes available. That way, you will not be caught off guard. If this helped clear things up, or you are excited about the no-needle option, like the video. It helps spread the word for people who are waiting on this release. Coming up next, Wegovy and your mood. Does it really help reduce cravings? And what about the people who say it affects their mental health? That one is personal. Subscribe so you do not miss it. And if you would consider switching to the pill, why? Let me know in the comments section.